final mile meeting is a little bittersweet because on one hand, it harkens back to this time last year where we had to cancel our Q1 2020 meeting. And believe it or not, the topic of that meeting was to be the global logistics impact of the coronavirus epidemic. It wasn't until March 11th that the WHO announced that it had circled the globe and was now a pandemic. So we had to cancel it. But on the other hand, thankfully, a year has passed, and it's not how you get knocked down, but how you get up. And we have mastered the virtual meeting from everyone's homes, everyone's offices, with the grateful technical expertise of our host association, Global Washington. If you or your organization are not members of Global Washington, please check out their website, talk to Kristen, and find out some of the member benefits. It's a great organization. So with each final mile meeting, we do 4 things. So one is we learn, and today we're going to hear from Leslie, Cyndie, Andrea, and Hootie about their organizations and how they pivoted during the pandemic. 2 is we network. As Kristen said, we're going to have a half hour after this for breakout rooms to see old friends and make new. 3 is we troubleshoot, and we don't have any topics for issues for discussion today, but if you are struggling with a logistics issue, give me a call, send me an email, we'll get it on a future agenda. And 4 is we have fun. And I know we're getting to the stage of the pandemic. There's a lot of quarantine fatigue. And the one thing that we all have the power to do is to make someone else's day and to cause a smile, to provoke a laugh. And that's just good soul medicine for us all. So I myself, I have to confess that I am susceptible to quarantine fatigue. Just this past weekend, I pulled out a world map, brought it from the office downstairs in the kitchen, and I said to my wife, throw the start at the map, wherever it lands, we're gonna go there when this pandemic is over. And I'm happy to announce that for 2 weeks, we will be spending behind the refrigerator. That's a joke. Okay, so now that I've caused a smile, I want, you probably noticed that I didn't mention the organizations in the intro, and I used our presenters' personal names. And that's because today I want to celebrate the people part of the greatness that our organizations accomplish. Whether it's global health or logistics, we're service organizations. Service is people. At Lynden, we celebrate everyday heroes, and the final mile is no different. So when you hear the stories of Splash and Fred Hutch today, let's all remember it takes incredible passion, long hours, endless commitment, and adjustments to both failure and success to achieve the goals they do, and that all of you do. So while this is a conversation about organizational pivot, at heart, these are stories of inspiration and aspiration from champions in our community. I myself, without these shining stars, there's no story to tell. I myself am personally grateful for the motivation they give me by example. So with that, let's meet Cyndie and Leslie from Splash. Cyndie Berg is the Chief Development Officer at Splash, an international NGO that delivers child-focused water, sanitation, hygiene, and menstrual health solutions with governments in urban Asia and Africa. She joined Splash in 2015 and has led the way in diversifying the organization's funding streams while building lasting relationships. Her passion is connecting individuals, companies, and foundations with exceptional social investment opportunities to help bring about a more just and sustainable world. Prior to this, she worked at Room to Read as Associate Director of Global Business Development. And though a California native and surfer at heart, Cyndie has embraced the mountains of the Pacific Northwest and loves to snowboard, cross-country ski, and hike. Leslie Llado. Leslie is a program management professional with 10 plus years of experience leading strategic initiatives in Africa, Asia, Central America, and the United States for corporate, nonprofit, and government organizations. She joined Splash in October 2017 and currently serves as Director for Infrastructure and Product Development, in charge of overseeing Splash's global water, sanitation, hygiene, infrastructure, standards, supply chain, and leads Splash's social enterprise to sell best-in-class hand washing stations. Leslie is a trained hydrogeologist and environmental scientist who is passionate about working with local stakeholders to solve complex problems. Outside of work, she's passionate about live music and volunteered for Austin City Limits, the longest running music series in American television history, for over 10 years. So with that, I'll give it to Cyndie and Leslie for the presentation on Splash.
Great, thank you so much, Eric, for your kind introduction. And I hope you can all see my screen. Great, perfect. So I won't go into that introduction because it was so thorough. So I'm just going to jump right in. Basically, I'm going to take a few minutes to tell you about Splash in general before Leslie gets into the main topic at hand, supply chain excitement. So our mission, Splash is focused on children in urban poverty. We have a vision to make sure that everyone has the resources they need to thrive and reach their full potential. And so we design child-focused water, sanitation, hygiene, or we'll call that WASH, and menstrual health solutions with governments in some of the world's biggest low-resource cities. We have over a decade of experience, and we've implemented 2,000 projects across 8 countries, which you can see below, benefiting almost 700,000 kids. Here is the core of what we do. When we think of water, we really are focused on making sure that water is safe to drink. So we filter water and we make sure that there's enough access. In terms of sanitation, we want to make sure that kids have access to decent toilets, which is not the case in the countries where we work. In terms of hygiene, we're uber focused on hand washing with soap, which was, we all know, during the COVID pandemic has become so critical as a way to prevent the spread of disease. We're focused on menstrual health to help girls succeed in school and beyond, making sure they have the resources and information they need to manage their periods. And lastly, behavior change is the piece that really pulls it all together. How do you convince kids to wash their hands? How do you convince them to keep toilets clean? Or even the importance of drinking clean water? That's where behavior change comes in. So this slide really talks about our big projects. So we've worked in 8 countries, but now we are really just laser focused on 2 cities, Kolkata, the 3rd largest city in India, and then Addis Ababa, the capital of Ethiopia. So Project Y stands for Wash in Schools for Everyone. We hope this is just the beginning in these 2 cities, but it's a big project, 1,600 schools, 1 million kids, and we are trying to do this all by 2023. So basically, we're focused on reaching every government school in these 2 cities because we believe that pilot projects don't scale. The core of the program is improved WASH infrastructure, behavior change programs for kids and adults, and then strengthen menstrual health services. And we hope the impact will be healthier students and improved school attendance, especially for girls. The last piece is that our goal is really to demonstrate a scalable, durable, cost-effective WASH in Schools program. Again, it's not to have a pilot project over here, a pilot project over there, but to show government, you can do this across a whole city and you can afford it. So our ultimate goal is that we are able to replicate this program to new cities and countries. By the end of 2021, we'll reach almost 400,000 kids at nearly 500 school sites. And now I'm going to turn it over to Leslie.
Great. Thank you for that intro, Cyndie. During the next portion of the presentation, I'd like to share more about how Splash's social enterprise adapted in 2020 given COVID-19. And my goal is to give you a sense of what 2020 looked like for a relatively small social enterprise producing and shipping products for customers in low and middle income markets. And to give you a sense of the scale that I'm talking about, Our sales revenues for 2019 were approximately $900K last year. So Splash's social enterprise was established in 2018, and it focuses on development of hand washing and drinking water stations that are durable, designed for kids, and help promote positive hand washing and drinking behaviors. About a decade of research from Splash's own nonprofit work went into our latest station designs. They were really designed in response to the fact that we couldn't find stations to use for our own projects at schools. And we began producing them in 2019 and now have thousands of those installed in Ethiopia and India. And while we've focused to date on proprietary sales to Splash International, our ultimate goal is to expand that model and sell at fair prices to other organizations that are working to expand social impact in low resource institutional settings. Next slide. And here you can see our existing stations. And I just wanted to highlight a couple of things about them. Core to the design are behavioral nudges like integrated soap dishes and the angular front to encourage positive hygiene behaviors. They have smooth, durable surfaces that make them easy to clean and maintain. And they're also height adjustable. So there's a riser on the bottom that lets you adjust the height so they can serve different ages of users with the same base system. This slide describes our original supply chain, which relied on a single manufacturer that was based in Coimbatore, India, freight shipping to via various companies. We just obtained freight on the spot market, and delivery to Splash offices in Kolkata, India, and Addis Ababa, Ethiopia. And we didn't have any dedicated internal logistics capacity. After a year of pursuing this approach, it was clear that it really wasn't working. We were spending way too much money. We were struggling to meet production and quality goals, and it was clear that our staff resources just weren't sufficient. Thanks, Cyndie. This slide shows the improved supply chain plan that we had planned to launch in 2020. We spent a significant amount of time at the end of 2019 working with a consultant. I believe Keith is actually on this call. He was one of the folks that helped us out with our new plan, but to think through how we could actually improve our supply chain in 2020. And the goals were really to first to introduce redundancy and hopefully improve quality by transitioning manufacturing in India to a higher quality vendor, and also beginning work with a new vendor based in China to fulfill all orders for Ethiopia. We also plan to consolidate global shipping under a single provider, Lynden. And when we launched this business, we were actually told that having a trusted and reliable freight forwarder should be one of our top priorities. And it was really clear after a year of working without that, that was really great advice. And it was something that we needed to implement. And finally, we had intended to integrate logistics responsibilities into the roles of existing and new Splash team members. So here you can get a sense of our original plans for 2020. The supply chain priorities that I previously described were integral to helping us achieve the first two goals that are listed here: to manufacture over 4,000 stations for proprietary sales to Splash, which was 3x over what we had produced the previous year, and to expand into non-proprietary sales. But as everyone on this call knows, 2020 didn't go as planned. And we realized really early in the year, as the virus began to spread in China, that we needed to shift. We experienced three major challenges in 2020. First, our manufacturers closed for long periods of time, up to 3 to 6 months, first in China and later in the year in India. And when they reopened, we had a lot of concerns about working conditions and had a lot of conversations with them to make sure that we felt okay about their health and safety practices. That was especially important given Splash's social justice mission. Second, we experienced the same global shipping disruptions that many of you that are listening today did. That included everything from really high prices, topped at $11,500 for a 40-foot container shipment, lots of bump shipments, and long shipping times. The leg of transit from Djibouti to Addis for us was particularly problematic. In addition to the COVID challenges that you saw along a lot of other global shipping routes, there was this perfect storm of reliance on paper documentation. So you actually had paper documents that were literally having to be couriered from one location to another to clear shipments, and there wasn't a digital option. We dealt with floods at the Djibouti port and with political instability in Djibouti and in Ethiopia that contributed to really excessive delays. And finally, coordination was a really significant challenge for us, particularly since we were onboarding 2 new manufacturers, and we needed to not only build relationships with them, but complete quality control for the first items that they were producing for us. So how did we adapt? Despite these challenges, we were able to adapt in a way that I feel really proud of, especially for an organization of our size. Pretty much off the bat, we realized that we needed to deprioritize non-proprietary sales and get things back on track. This was disappointing given that we felt like our products were really critical for COVID response, but we realized that it would be a struggle to fulfill our existing orders of 4,000 stations for Splash International otherwise, given the limited production capacity that we had with our vendors in China and in India. And we also knew that once schools actually reopened in India and Ethiopia, where these stations that were being purchased by Splash International were installed, that hand washing would be even more important than ever for COVID response. So we felt like it was really critical to make sure that we could meet this commitment we had made to Splash International. Next, we focused on activities that we had already planned for our supply chain. So we proceeded with remotely onboarding 2 new manufacturers in China and in India. We did this with a lot of communication virtually through WhatsApp, WeChat, etc. And we were also really strategic about our quality checkpoints. So we reduced them to really just the most critical points where we felt like we needed to have feedback on these new products that were being produced. And we actually invested in air shipping for time-sensitive samples. So, we paid extra to ship samples to Seattle quickly so that I or other team members could approve them in person. And finally, we also relied on the Splash teams in Addis and Kolkata for additional support. We had also maintained the originally planned investment in logistics, building the Lynden partnership to manage 17 international shipments over the course of the year and building Splash capacity. In addition to improving everyone's sanity, including my own, and ensuring that we could get work done on time, we saw a 70% reduction in our demurrage fees over the year as a result of those changes. And I can't emphasize how critical the Lynden partnership was for us in 2020. We really couldn't have gotten that far without having a trusted and effective logistics partner. And then last but not least, we launched a new project to develop a hand washing station for COVID response, which I'll share more about on the next slide. So with a team of design enthusiasts like you have at Splash, as soon as we finished our existing stations, we were thinking about how we could make them better. With the COVID-19 outbreak, we saw an opportunity to iterate upon our existing hand washing station design and create something that was more broadly applicable to institutional settings like healthcare facilities in low and middle income markets. And our existing stations worked in these settings, but we knew they weren't quite the right product. We were actually able to install some at healthcare facilities in Ethiopia as part of a COVID response project last year. So we got some good learnings from them to build into this new project. And we secured 1.6 million in funding for this project in 2020. We started work last July, and that will continue through the end of 2021, at which point we anticipate that we'll have a new product to bring to market. So finally, despite a difficult 2020, we're now at a point where we have a strong supply chain in place for our products. Looking forward, we intend to focus on building out our business operations, including capacity to sell stations to organizations outside of Splash. We are looking at building our capacity to manage our existing products and completing development of this new station product that I mentioned by the end of this year. We really appreciate the opportunity to share more with this audience and are happy to answer any questions from the group at the end.
Fantastic. Thank you, Leslie, and thank you, Cyndie. And as an end note, I had to tell a quick story about how we had an air shipment that was coming into Seattle and it was going to Leslie's home, and I was horrified, and I was so mad that someone had gotten hold of and had confused her home address with what our facility would have been, and it was one of those samples that she was looking to personally approve that was going to her doorstep to her home so that she can get that done in times of lockdown. And she said, no, it's quite all right. But I thought that there was a tremendous breach of personal information, and but that shows you the commitment of the Splash team, though. Fantastic, well done. So now I want to introduce our Fred Hutch team. First, we have Dr. Houston Hootie Warren, not to be confused with the Dr. Houston Houdat Warren from New Orleans. Dr. Warren has been with Fred Hutch Cancer Research Center for 28 years, starting his fellowship in medical oncology. He is currently program head of global oncology and professor in clinical research and vaccine and infectious disease divisions at the Fred Hutch. He's also a medical oncologist at the Seattle Cancer Care Alliance, with a practice focused on patients with lymphoma. He received his AB and PhD in neurobiology from Harvard University and his MD from Harvard Medical School. He completed his residency in internal medicine at the Massachusetts General Hospital in Boston before heading west to Seattle after being inspired by Dr. E. Donald Thomas's Nobel Prize awarded in 1990. He notes that, when I read about Dr. Thomas's contributions to the development of bone marrow transplantation, I immediately wanted to go to Fred Hutch. Since his move to Seattle, Hootie has designed and led Fred Hutch's first clinical trial of T-cell therapy for patients with leukemia. He co-invented with Fred Hutch colleagues a high throughput sequencing technology that enables researchers to see how the millions of different T cells in each individual are programmed to target diseases. He also runs a laboratory focused on cancer immunology, with a particular interest in the cellular and molecular mechanisms that mediate cancer regression after immune-based therapy. Since 2017, Dr. Warren has served as the head of the global oncology as the head of the global oncology program at Fred Hutch, the primary focus of which is the operation of a 30,000 square foot cancer research center located in Kampala, Uganda, on the campus of the Uganda Cancer Institute, UCI. The Fred Hutch and UCI have a longstanding collaboration centered on the prevention, diagnosis, and treatment of cancers that are prevalent in sub-Saharan Africa. Some fun facts about Hootie: he has sailed from New Zealand to Hawaii on a 37-foot stay sail catch. He's a Premier League, that's American soccer, what we call soccer league fan, and would like to visit all the Premier League stadiums someday. He is an avid hiker and summited Mount Rainier 4 times. And I'm going to separate those two comments, avid hiker, because summiting Mount Rainier is not a hike. 4 times. So welcome, Hootie. And Andrea Ellerton has been at the Fred Hutch for over 10 years, working in the clinical research division and with the global oncology program, where her passion in research resides in cancer genomics. She is the clinical research division program manager or project manager, and she is the acting laboratory director of global oncology for the UC and Fred Hutch Cancer Center facility in Kampala. Our main focus has been managing high-level scientific research projects at laboratories efficiently, cost-effectively, and with precision. She has immense joy in connecting and bringing cutting-edge scientific research abroad, focusing on building capacity, training, and developing better therapies for treatment of cancer and other diseases. Some fun facts about Andrea. She is a former D1 athlete. That is the highest, if you don't know, it's the highest NCAA intercollegiate level you can get, and now enjoys mountaineering and skiing. She has an extensive collection, a stamp collection, and is a member of the Philatelic Society. And she loves to grab her favorite coffee drink of cappuccinos at Schiphol Airport at the grab and fly kiosks. So with that, I will turn it over to Andrea and to Hootie to hear about your last year. Thank you.
Thanks, Eric. You've tapped into my ultra nerdum level of stamp collecting and favorite cappuccinos at the airports. I'm going to share my screen here, and Hootie will hopefully start off here, and let's see if I can do this correct. Okay. Can everyone see the screen? Perfect. Okay, Hootie, go for it.
Good afternoon, everyone, and thanks, Eric, for that very kind, overly generous introduction. It's really a great honor to spend a few minutes with you all representing the Fred Hutch. The Fred Hutch is a fabulous organization with which I've been affiliated for 28 years, and I couldn't be happier to work with the people that I work with there and to be affiliated with such a fine institution. What I'm going to talk to you about, and what really Andrea will describe in more detail than I, is the effort that was taken on the part of a number of people to pursue a small fraction of the research that the Fred Hutch carries out, and hopefully you'll extract from that what's emblematic about how the institution as a whole works. It's really a fine institution. All of you are, I suspect, are familiar with the Hutch, but the mission of the Hutch is the elimination of cancer and related diseases as a cause of human suffering and death. And at the Hutch, we aspire to conduct research of the highest standards to improve the prevention and treatment of cancer and related diseases. And obviously, that's a large task. But I wanted to point out the Hutch campus on South Lake Union, encompasses a number of buildings. There are 3,000 staff, almost 250 faculty, and I would need hours to really describe how the entire institution pivoted to meet the challenges that were triggered by the SARS-CoV-2 pandemic. And amongst that, I would just point out that our physician scientists played in a critically important role in identifying the pandemic at the start. Trevor Bedford, many of you may follow his Twitter feed, was one of the scientists that really identified community spread, the first scientist to identify community spread of SARS-CoV-2 in Western Washington, which was critically important, and really refocused everyone on the challenges that the growing pandemic posed. I would need hours to describe how the Vaccine and Infectious Disease Division, which for years has conducted just groundbreaking research and development in research supporting the ultimate development of vaccines for HIV, pivoted overnight on a moment's notice to really focus on the development of vaccines for SARS-CoV-2 and the prevention of COVID-19. And that continues to be a major effort of the Hutch. And I wish I could talk more about those, but what I will talk about, and Andrea, as I said, in more detail, is just a tiny fraction of the Hutch effort. And that's the effort that's involved operating the research center that we have on the ground in Kampala, Uganda. So 11 time zones and 8,800 miles away from our campus on the shores of South Lake Union is this brick and mortar structure right here. It looks a lot like our campus in Southeast Lake Union, which is the heart and soul of our global oncology program, the focus of which is cancer research. And I would just point out that the Hutch operates another another research center in Africa, in Cape Town, Republic of South Africa, the focus of which is HIV vaccine research. But the supply chain and the supply lines to the UCI Fred Hutch Cancer Center are long and tenuous. And when the pandemic broke out, they were threatened and we had to pivot. And we did so very successfully with the aid of Lynden and a lot of other partners. And Andrea now will talk to you more about that.
Okay, so in regard to just a few things in maintaining the forward progress during the pandemic. So one of the main issues and what we started with was essentially compiling a group of people that we started working and having a weekly operations group to start addressing some of these supply chain issues, what we were going to do to keep our operations on the site open. And so we currently have over 14 active research studies and over 2 clinical trials that are currently ongoing, and keeping those operations going and how we needed to take care of those. And so that required a lot of implemented risk management plans that our team in Uganda and also in Seattle had to work together and also with the institutional bodies in Uganda together to make those happen. And during this time, we completed a construction of a build out on our ground level on the campus, which added over 2,600 square feet to our site. And so we wanted to continue those operations moving forward. And with that, we also were able to, one of the biggest things that we realized that we needed to do to continue our operations and part of our risk management plans were to implement SARS-CoV-2 testing. And that was to keep the safety of our participants and our staff on campus and in Kampala in order to continue our research operations. And so with that, we really needed to be able to not only learn how to implement these assays effectively, but also to be able to source all the necessary reagents and PPE appropriately to be able to carry out those assays, but also to be able to supply them over to Kampala. And then in addition, the other part of that was, well, we have these assays, but now we have to work closely with the Ugandan Ministry of Health to be able to pass rigorous laboratory inspections, not only with the Ministry of Health, but also with the WHO. And so one of the things that, as Hootie mentioned, I think has been an ongoing theme is it's literally overnight in the pandemic for not only Fred Hutchinson, but for many organizations, we had to pivot incredibly quickly and to find where can we source PPE. It became incredibly scarce, incredibly expensive. And not only in one additional layer was how do we source PPE quickly and efficiently, but also be able to ship that to our sites over in Kampala, Uganda, and also into other parts where I think all of us on this call are operating globally and with our collaborators. And so I also just wanted to really much commend and echo what Splash has said on this call is that Lynden was absolutely been an outstanding partner and unbelievable. I know there's many on this call that we would not have been able to do any of this without Lynden. And it was just, and the best part about it was an absolute joy and the positivity in terms of the COVID pandemic and how making this so efficient was just such a wonderful experience. And so not only do we use standard PPE for laboratory assays on a daily basis normally, but now we had to implement the use of PPE for routine everyday activities, just being on campus and wearing surgical masks. And then now we're handling specimens that our laboratory personnel would now require additional PPE every single day to carry out testing. So this was a huge overnight pivot that we had to be very quick, efficient, and cost effective in how to source this. And it also required the logistic part of actually shipping these cold chain reagents, pallets of medical supplies, and also dealing with the logistics, which was also incredibly important to work with Lynden, and also understanding just the exporting of PPE out of the United States during last year was also challenging, and making sure that all of these processes, we were being able to just pivot on even a day-to-day basis, which was incredibly challenging, but also we were very fortunate to be able to work with such incredible people during this time. And so these were just some of the pictures that were taken throughout the year that I actually have a picture of me sitting on one of the Lynden boxes because I thought it was pretty useful in the future to pack ice cream, perhaps, so thank you, Lynden, for for all the different sizes of packaging. But and then one of the other things that I think, which was, I think, shared amongst a lot of institutions throughout this year was being able to, a pivoting point for everyone is to quickly establish laboratory assays to effectively test for SARS-CoV-2 in the pandemic. And we realized that this was a major point for the success of keeping our patients and our staff not only safe, but on campus, but also to be able to continue to carry out our research objectives and deliverables in Kampala. And so I put a timeline up here. There's a lot of text here, but it's definitely one thing to implement laboratory assays when you're physically on the ground, but to do that 11 time zones away and to be able to do it 9,000 miles away is a different experience to be able to implement. But we also went through rigorous testing and became part of a national testing program. And now we have this as a routine assay that we are able to provide and has been successful to be able to keep our operations moving forward, but now is just a routine part of our operations, which I think is quite a success story. And so one of the other things, so now here we are, right? And so one of the last points that I think, as Hootie, I think mentioned is there's quite a bit that we could talk about as an organization as whole, but I think one of the other things that I think I'll let Hootie take, to wrap up our presentation, but is also the equitable distribution of vaccines, and in which I think I'll pass this to Hootie to end our presentation.
Thanks, Andrea. Indeed, we're in 2021 now. We're pivoting yet again, and all eyes across the world are really focused on the development, the approval, the distribution, and equitable distribution of vaccines, not just here in the United States, but across the globe. And that's really a reflection of far more profound and widespread and important events and movements, initiatives that really were triggered by the pandemic, the accompanying economic upheaval and chaos, and the singular events that focused the eyes of the world on the systemic racism that even in 2021 exists in our society. And so I wanted to focus just for a second in the closing moments on how central to everything that global oncology does, the concepts of diversity, equity, and inclusion are. The Hutch really, I think, has been in the vanguard here. So long before the pandemic, long before the events, the terrible events in late May, where George Floyd was murdered. The Hutch established an Office of Diversity, Equity, and Inclusion to really help us make progress in that direction, progress which is long overdue. And so on the left here, I just wanted to really bring to your attention the DEI team that really led this effort through 2020. Anna Parada, Dr. Paul Buckley, and Dr. Chris Lee. That team's now been joined by Nikita McPherson. I'm sorry, Nikita actually is misspelled. She only has one K in her name. But with the enormous leadership from the Office of Diversity, Equity, and Inclusion, really the Hutch is pivoting again, as I said, to look at vaccines for ending this pandemic and assuring that those vaccines are distributed equitably and in a timely fashion is going to consume the focus. And so I wanted to give a shout out to an event that Global Washington will co-host in a couple weeks, if I'm not mistaken, Kristen, that will involve Dr. Stephan Wallace, who is the Director of External Relations for the HIV Vaccine Trials Network, which is based at the Fred Hutch and the corresponding SARS-CoV-2 vaccine development effort, and some others, including Dr. Steve Pergam and Michelle Andresik, and the contributions they've had. The event that Kristen will tell you more about in a couple of weeks will also include Rebecca Bryant from the Hutch, who may be on the call at the moment. So that's all we wanted to say in terms of prepared remarks, but we just wanted to thank Global Washington for permitting us for the invitation to participate, and thanks to Lynden for everything that they've done to allow our global oncology program to keep moving forward despite this very challenging epidemic and all of the other events that it's triggered.
Thank you very much, Andrea and Hootie. And just a quick disclaimer: this was not meant to be a Lynden infomercial in any way. And we do have time for some questions. I do value these clients very much. We do get to see part of why we wanted to engage them is you could see how they were able to really change operations on the dime in some very difficult situations, and both of them name them that you can't ask for more difficult environments to work than Addis Ababa and moving material from Djibouti to Addis for operations there, especially in the last year during the pandemic, and lots of other things that have happened. And on the Fred Hutch side in Uganda, there was violence during the elections. I can tell you there were times when we had messages from Entebbe that of frightened individuals who did not want to drive the road to Kampala, and these were hopefully we'll move past that, but these are always challenging environments, and they were made much more challenging during the pandemic because a lot of things aren't working in the same pace or the same fashion that they did before. So a question that I had for both groups, and we'll start with Splash first, is that because one of the things I've been impressed with is how both organizations have maintained like outstanding communication throughout their organizations from the field to everyone involved here in the United States and in different countries, and kind of just give us a glimpse of that, like, because we all know how we do it here. It's what we're doing right now, and our stretch is like West Coast to East Coast Zoom time, and it's got to be. So when you, is that how it looks like with your team? Because like Leslie, I know you communicate with a people in different time zones and make it happen famously. Is that all like on a Zoom platform, or are you getting on the phone, or is there, how do you make that happen?
Yeah, there's probably a more organized way to do it, but I'd say it's a little bit of everything. We use like Zoom, Teams, WhatsApp, WeChat for colleagues in China. So I really try to just adapt to whatever, whatever the teams I'm working with in India versus Ethiopia, et cetera, are most accustomed to using. And it definitely means, I know for Splash, if you look at our office calendars, it's a lot of coordination that happens either late in the evening Seattle time to interface with Ethiopia working hours or early in the morning. So we try to have a schedule where things are equitable, and there are some night calls for Ethiopia and India and some night calls for Seattle, but it's there's not really one formula that makes it simple.
Got it. How about for the Fred Hutch team? I know, Andrea, you in the same fashion, you must have more technical challenges, because I know that even communicating with you, we've had to share pictures like, okay, this looks like this, and what should I do with it? And that's just on a very basic level of operation, but you're working with a technical team, and that's got to be a little bit more difficult.
Sure. I think I would agree with Splash as well. I think time zones, obviously, we're 11 time zones difference. And so I think I think the biggest challenge for, I work directly a lot with our laboratory team, and validating assays are a little challenging, where training on a Zoom in a lab is challenging to do at midnight, 1 a.m. here Seattle, and teach via Zoom pipetting and laboratory assays. It was a different experience, right? But I think I think amongst everyone on this call, it's nice to be in a community of very well-minded people who are very dedicated to a cause to make things happen. And so I think if there's a will, there's a way. And so communicating with our team, WhatsApp is, obviously a great communication tool, and the commitment to just constant communication and communication is really the key to success, right? And so making a commitment to, be able to check in, daily, and, emails are effective to a point, but being able to actually call and show you're showing up, right? And showing up to your team, I think, has been very effective. I know as a broader programmatic, and I think Hootie could speak to this as well too. We had weekly COVID operations meetings between our Uganda team and our Seattle, site, in which we would meet weekly to discuss a lot of the different various, departments within our program, and what was working, what was not, and how we could effectively, help mitigate some of those challenges we might have been experiencing. I don't know, Hootie, if you would like to add to that as well.
Yeah, just a quick comment. I just wanted to thank Raquel Sanchez, who's the managing director of Global Oncology, because she led all those weekly operations meeting and did so very ably. And so thank you, Raquel, for really all that effort. To follow up on a comment that Eric made, not only did we have to deal with the pandemic, but we did indeed deal with a lot of civil unrest in Uganda that was triggered by the run-up to the January 14th presidential election. And that civil unrest actually forced the closure of our cancer research center for multiple days, both in November and December, as well in January. The government of Uganda shut down the internet for at least 3 or 4 days prior to the election, and for several days thereafter. And that, as you might imagine, made communications more problematic than ever. And we were trying to continue to operate. So it was, redundancy of communication channels and is the key. We, for several days, really just relied on text messages, which is about all we could do to get through. But it reminds you how fragile our communication systems are. We did not expect the internet to be shut down, but nonetheless it was, and it was shut down for nonstop for about 5 days, and that obviously created difficulties that were unexpected. But the team, once again led by Raquel and others, really navigated those very well. So Thanks, Eric, for reminding me about yet another wonderful memory of the past year.
Thanks, Hootie. Here's a question for Splash, and Patrick Binns asked, very impressed with the wash stations. Wanted to know how do your customers access things like soap and the connection to the local water supply? How does that occur?
Yeah, maybe I can start and Leslie can answer anything more technical, but basically our customers right now are schools. So we are deploying these at municipal schools that have pipe water. The soap is actually something that's part of our behavior change program. We encourage kids we hold a soap drive every year, and we encourage kids and their families to contribute 1 bar of soap each. So that pretty much stocks up the supply for the year. But in terms of the municipal water piped into the stations, over to Leslie.
It's actually pretty easy. Our stations are designed so that they can be connected to any piped water source. So in the context where they're installed in Addis and Kolkata, typically you're just connecting them to municipal water that's already piped into campuses. That being said, we think there's also potential for them to be used in more off-grid settings where you say had like an elevated water storage tank. And we have seen some examples of that at school sites in Addis where that has worked well.
Great. And I want to get back to Hootie's point about equity and vaccinations, and I know it has been breached and has been discussed with states and the CDC, and the CDC has said, as far as like employees overseas or facilities overseas, from their standpoint, anything that goes to the states stays in the states. So you cannot, we could not ship vaccines for you now. That's the ultimate ruling from last week, and so they have 3 programs. They have the DoD program, they have the Department of State program, and they have the domestic state program. So if you're not part of one of those 3, you have to get your vaccines within that country program. So and I know that you've been very active in pandemic response within Uganda. Are you going to get prioritized? Is your facility going to get prioritized at the same level as we're trying to vaccinate our medical staff and first responders here, or is there a different plan for Uganda?
Eric, we don't yet know the answers. Vaccination is already underway there are 54 countries on the African continent, and COVAX is actually already distributing a large number of doses of vaccine in a number of different countries. And I can't tell you that I know that COVAX doses have arrived in Uganda. Vaccinating our staff there, and more importantly, all of the patients that really are the reason we're there, is an incredibly high priority. There are a lot of uncertainties right at the moment, and as you pointed out, there's no clear path to exporting vaccine just straightforwardly to the site right at the moment, and we continue to devise and really improvise probably on how we can go about that. I'm not sure if that answered your question.
It does. Thank you.
Yeah.
And we had a question from Keith that I'll answer real quick. He asked, when do we expect shipping to get back to pre-COVID conditions? It's not happening in the next few months. I can tell you that. It's improved. Air freight has improved a little bit to Africa, and ocean freight is a complete disaster right now. So like we've never seen in our lifetime. So that impacts Splash very heavily for what they do to Addis. It might help improve what Fred Hutch does to their facility in Kampala. So that just as a basic. And then the last one is from Charlie, my boss, so I have to ask it, is to Splash. And what countries do you anticipate going to next?
I can take that one. I mean, in terms of just hand washing station sales, we're really open. I think that we've identified market opportunities in Northeast Africa and in Asia. And as part of our work in 2021, now that we really have our supply chain in order, the next step is really to start aggressively developing our sales and marketing approach for these products. So TBD to a certain extent, but we have had really good feedback for those two markets.
And then for Splash more broadly, we are really focused on our two cities, Kolkata and Addis Ababa, but stay tuned over the next couple of years. We're starting to look at secondary cities in Ethiopia, and we are interested in other parts of South Asia. Dhaka has come to mind a few times. Stay tuned.
This is Hootie. I just wanted to, thanks to Adam Drolet, who just sent me a link to a news report that as of March 5th, Uganda had received 864,000 doses of COVID-19 vaccines. I think the AstraZeneca adenovirus-based vaccine. So that's great news. And thank you, Adam, for bringing me up to speed. I want to make one more comment, that I didn't, we passed, so all of us have used gallons of hand sanitizer over the last year, and we've used ethanol to spray off all kinds of surfaces. It came as a surprise to me, perhaps not others, that these are dangerous goods because they are indeed flammable. Hand sanitizer, which is alcohol-based, and of course alcohol. So those supplies can't go on pallets with everything else. They have to go up. Their shipment is very stringently regulated. Eric knows far more about this, but just our simple desire to send hand sanitizer and alcohol wipes to our staff at the UCI Fred Hutch Cancer Center in Kampala proved far more complicated than we would have ever imagined. And we got some nice help to solve that riddle.
Nice. Well, very good. That wraps up our program time. So I want to give a big round of thanks to all our presenters. Fantastic. And I'll let Kristen lead us into our breakout rooms. And I do have a networking icebreaker if we need one.
Great. Thanks, Eric. And thank you again to all the speakers. This has been fascinating and so timely. And I know it's of service to other organizations that work in global development. We all had to pivot last year. So it's great to hear how you all did it so successfully. So right now we're going to go into breakout rooms. However, the webinar format does not allow breakout rooms. So what we need you to do is click on the link that is in the chat right now. And that will put us into the format where then we will break you into breakout rooms. So click on the link and then we'll put you in breakout rooms. And then Eric can tell us again what the icebreaker is, and we'll put it in the chat so that you have it as well. Okay, so click on over there and then we'll get ready for the breakout rooms. Thank you all.